Hi friends, this is Dr. 𝗙𝗃 Reddy. I'm an orthopedic surgeon practicing in Hyderabad. I'm a chairman of Sunshine Bone and Joint Institute, which is one of the largest orthopedic institutes in India. I have 20 consultants working with me in all various subspecialties. We do around 10,000 major orthopedic procedures every year, out of which 4,000 are joint replacements. I have spine surgeons, pediatric orthopedics, trauma, like that. There are many people. Today, my intention, and we are very happy and privileged to be associated with the DocTutorials, because we have provided the curriculum for the orthopedic modules, and our research director, Dr. A.V.Gurava Reddy, is one of the instrumental teachers and one of the postgraduate deans who has given a lot of content and a lot of guidance to me. I'm sure you all must be happy and appreciating the curriculum. If you got any more doubts and any more suggestions, we are always happy to better the content. End of the day, I want all of you to pass MS Ortho first shot. There is no second thought about it. So we are creating the curriculum in such a way that, in fact, you don't need any teachers. You just go through this DocTutorials MS Ortho module and you will be ready for the exam. And today I'm going to talk to you on a very generic note. And if anybody has got any doubts or questions, please put them in the question box. I'll be happy to answer them. And I think they can also interact with me. Am I right? Hello?
Yes, sir.
Yeah. If you want to interact with me, you can switch on your video and ask a question also. So basically today, I'm going to talk to you. I'm now, let us say, almost 25 years into medical practice in Hyderabad. Before that, I spent 10 years in England. So the orthopedic has come a long way now in 2024 compared to when I was in medical college in 1977. So let us say almost 50 years. It's a beautiful branch to do post-graduation, and without any hesitation, I would put it as one of the top 3 branches anywhere in the world for the doctors. And now I'm happy that many young ladies also are taking up the course, and I'm really thrilled to see them taking up orthopedics. Now, a lot of people have got doubts, what will we do after orthopedics and all that stuff. There are many methods there. So the number one is to decide what to do. There are many methods and many modalities. Number one, after MS Ortho, I would advise you not to jump into practice immediately. First thing is spend another 2 to 3 years in post-MS practice, almost like a senior residency. So like in all central institutes, after MS, they got a senior residency programs, and whereby they do another 2-3 years training. I would feel that 2 to 3 years is very important, because during your MS Ortho, you will not get very great perspective or hands-on for the surgical techniques. Not only that, the decision makings. Because MS Ortho, you will be half the time you will be doing the ward work, half the time you will be doing the thesis work, and half the time you will be doing the dressings and suturing work. So seldom you come across a time to do the perspective or make a decision making. So I would advise all the MS Ortho guys, the moment you pass, don't jump into private practice. Work in some place, either with your seniors or in your institute or in an institute like us for another 2 to 3 years. Somebody is asking a question. Yeah. So that post to MS 2 to 3 years is very important and vital. And afterwards, then you can decide, or during this period, you will decide which way you are going. And of course, for MS Ortho, Post MS ortho, suppose you wanted to continue with orthopedic scenario, there is no way you can go to America and settle down. Because for America, orthopedic residency for outside American candidates is almost zero chance. So forget about that. So if you want to go to America and settle, then you have to leave orthopedics. So either orthopedics or America, as simple as that. Then coming to other countries, England or Australia, there are two other English-speaking countries. England, there are reasonable chances for orthopedic surgeons, but again, you have to start all over again. You have to start from 𝗙𝗪 level and the 𝗙𝗪 level and work all the way through, again spending 3 to 4 years. Just now one gentleman said, sir, my seniors took MS ortho because within 1 year they can settle down in the practice, which is a very right. That is 𝗙rie𝗲𝗃. Okay. Many of my seniors, because they thought they could settle in 3 years' time, is super necessary in ortho to make a good career. So 𝗙rie𝗲𝗃, super specialization is not needed, but it depends on your place of practice. If you are practicing in tier 2, tier 3 metros, a general orthopedics with a specialization or a more than optimum expertise in 1 or 2 branches will be very useful. Anyway, trauma you have to do very well. So, but general orthopedics only doing just trauma may not be enough. So you have to do spine or arthroscopy, something like that. So that is a very, very important thing. So after MS ortho, I would advise you decide your place of practice. Place of practice again is important. First thing is, it depends on your background, it depends on your roots, and it depends on your choices. It depends on your wife's roots and all that. Because you don't need to practice in places like Hyderabad and Bangalore. You can practice in tier 2 cities also. Okay. So if you are settling down in Hyderabad or Bangalore like a tier 1 metros, the competition will be very fierce. But of course, the chances and the opportunities are also more. What I suggest is, if you want to practice in Hyderabad, because you got a parents, your wife is from Hyderabad or from metro, don't be intimidated by other senior surgeons. That is my first advice. Because whoever is however big they are, you will have your own practice 100%. Only thing is time takes time. But it all depends on your level, place of practice and your way to deal with the patients. So Surya Narayan is asking, sir, is it the same with Australia? Can we practice in any other country with Indian MS ortho? Indian MS ortho, you cannot practice anywhere unless you do again their entry exams. Australia, New Zealand, all of them are same. Some of the things are remote like Maldives or Fiji Islands. There are some of the Caribbean islands where you might be able to practice your MS ortho, but you got to apply for the local license rating. So Surya to host, sir, recently I got my NEET PG results. Is DNB ortho better or MS ortho? Need your guidance. I'm passionate about the branch. And Surya, nowadays there is no difference between DNB and MS ortho. I am myself DNB. I didn't do MS ortho. So DNB ortho is as good as MS ortho. I would advise you to pick up a good special place where you can do the DNB. So DNB is as good as MS ortho. Gone those days where you need MS ortho degree. Because now even for government jobs, DNB is very much recognized. So sometimes DNB will come cheaper than MS ortho. Sometimes DNB you can get in a better institute than MS ortho. Go and do the DNB. So there are no differentiating factors at all between DNB ortho and MS ortho. So that is a fundamental thing I wanted to guide you. And what is the scope for arthroscopic surgery? Rajneesh. So Rajneesh, arthroscopy is a very good branch. After the joint replacement, arthroscopy has got the maximum practice along with the spine and trauma. So arthroscopy, again, it's not a rocket science, but you need to get a good training. The triangulation and arthroscopy techniques take time, but you got to be trained properly. If you pick up arthroscopy, I would advise you to pick up arthroscopy of the knee and shoulder as well. First, get into the knee, and after some time, specialize in the shoulder also. Akhil, good afternoon, sir. I am a second-year postgraduate student from Guntur. What is the best pathway we should practice regarding both theory and practice to be a better outcome student? The better pathway, Akhil, is to practice between your 3-4 friends every day the clinics. That means one guy will be a patient, one guy will be examiner, one guy will be the student. I done that for 2 MCH days in Liverpool, wonderful results. So that you will not get that fear and you can enjoy and you can learn how to talk in front of the examiner without fear. So that is very important thing. So now let me go through that. Once you specialize or once you decide on which way you practice or which city you practice, select a nice place. Don't spend hundreds of crores and build a big hospital on the day one. Start with a modest background and you can go and settle in somebody else's place like corporate hospital. Or if you don't have a corporate hospital, then you can put a small clinic with operating opportunities in the corporate hospitals. So after some time, after 3-4 years into the private practice, once you got enough stamina, once you got visibility, once you got enough expertise, then you can start a hospital on your own or 2-3 people put together. Nowadays, there are good models whereby one guy will be a joint replacement surgeon, one guy will be arthroscopic surgeon, one guy will be spine surgeon. Like that also 3-4 people can start a hospital with an appropriate understanding right from the day one. There are good models, again, where you don't need to get into the fights. All of you come into a common path and then do the practice. That's a better way of doing that. Next, what do you put it well? Can we join senior residency program in Sunshine Hospital after immediate MS orthopedics? Abhilash, yeah, Abhilash, you can join. There are programs in our hospital. Fellowships are there. You can join as a senior resident also. You can come and apply to us anytime, or you can talk to one of our senior consultants, Ratnakar, who is in charge of the residency program. And Roshan Raj, good afternoon, sir. What is your view on orthopedic oncology as a future prospect? I'm a currently first-year resident, inclined towards oncology. Roshan, oncology is a very underserved. In fact, I am struggling to get an ortho-onco surgeon on my roles. So oncology is a good branch, but only thing is you cannot confine yourself to one hospital. You have to be in a tier 1 city with attachment to 3-4 hospitals where you will cover their requirements. I'm sure orthopedic oncology has got a good future. I've seen many oncology surgeons having a roaring practice, but you will be moving 3-4 places, not in one place. So that is the important point. And you should learn all the limb sparing techniques and all these things by doing a 1 or 2 years of fellowship in one of the leading cancer hospitals. Okay. So next, right. So once you develop 2 years of post-MS practice, and again, as I said, you can go into your own practice or you can keep working in the corporate setup. Working in the corporate setup has got its own plus points. Number 1 plus point is you don't need to worry about the infrastructure, whether the ward is coming or latrines are working, theaters are working. They got a good setups. So if you got a corporate hospital in your place, take one unit and develop your own practice nicely. And developing a practice is very, very important. There you have to put all your personal things there, like you have to treat the patient as your family member. Absolutely. Okay. Right. Now, next, oncology. Next, is orthopedic traumatology having a good scope currently? Navya. Yeah, traumatology is a bread and butter, Navya, for every orthopedic surgeon. So you have to learn all the recent trends in trauma. And trauma, you have to develop a good outcomes. Any branch of orthopedics, you should develop a good outcomes. End of the day, non-infective and excellent outcomes should come. So the people who are wanted to settle in a group practice, they can do by 3-4 people coming together. And the people who want to start their own hospital, my advice is number 1, wait for 2-3 years. And number two, don't put too much money into that. It will become a very much high pressure point. So take some loan, start modestly, but start a good theater facility. Don't compromise on theaters. Very, very important. Okay. Again, another Divya, DNB or MS Orthopedics. There is no differentiation. You can take anything which you want, where you want. DNB and MS are equally creditable nowadays. So you don't need to worry at all anymore, Navya or Divya. So now where are we? So now some people want to go into orthopedic teaching jobs. That's also perfect. If you are a cool guy, if you want only 9-to-5 job and not bothered about private practice, you can get into any medical college. With MS Ortho, you will start as an instructor and then assistant professor, then professor within 10 years or even less than that. And you can enjoy the teaching. You may not get that much money as you get in private practice, but again, it's all personal choices. And another important point which I want to highlight to all the youngsters, don't put money as a number one criteria for your career. Please, please, please. Do everything. Money is an automatic byproduct of your success and of your good nature and of your ability to connect with the patients. Sir, you are a legend in this branch. Can you share your best encounter so far? It will be very inspiring for future practitioners like us. Karthik, I'm not a legend. I don't claim myself legend, but I'm senior enough. Best encounter means I've done so many surgeries. The most happy and the most fulfilling surgeries are on rheumatoid arthritis, young ladies, where I replace 4 joints within 2 weeks and put them back onto their feet from the wheelchair. That is a wonderful experience and I enjoy that moment. And again, Karthik, do the practice with the heart. Every patient is a family member. The moment they come into your clinic, they are no more patients. They are your family members. The moment you think them as your family members, then you are done. The whole practice will take a beautiful shape and your indications will be very nice and you will have excellent results. That is number one. Okay. Sir, Sri, which is better after orthopedics, pediatric or arthroscopy or onco? It all depends on your interest, Sri. As I said, arthroscopy has got a more volume than pediatric orthopedics. Pediatric orthopedics after the polio and cerebral palsy are very well taken care now. So the pediatric orthopedic practice, again, the volume numbers are less. But again, pediatric orthopedic, you cannot stay in one hospital. You got to visit at least 3-4 hospitals as a visiting consultant. Then only you will have enough practice. Oncology is same. So private practice is better or should work in a private hospital or government. Again, it depends on your way of looking at the life. Three. If you want a cool job without any hassle, then you just go into the hospital and then take a job. As simple as that. Okay. Yeah. Sir, guide us some important tips for the final year postgraduate exam in 4 months. That is Abhilash. Abhilash, take all the old question papers and read them and prepare answers. And of course, all DocTutorials has got it. You don't need to go anything outside. But the current thing, definitely there are some recent advances like COVID implications of orthopedics. You should know COVID implications of orthopedics like avascular necrosis of the femur, its incidence, how do you tackle? So those things are important. Otherwise, all old question papers. Coming to the clinics, as I already told you, 3 of friends, you make a group. One day, one guy will be patient. Let us say he will have a virtual TB hip and you will examine and another guy will be the examiner. So that is an easy way to communicate in between. Second day, you become the patient. Your friend will become the examiner like that. Okay. And then keep on talking to yourself. Again, Abhilash, what I'm telling is most of the people will get a, the examination jitters and pressure and they can't open the mouth. So what I suggest is when you are in your room on your own, you just switch off your light and then say, For example, the examiner asks you, what is a Trendelenburg gait? Then you talk out loudly, Trendelenburg gait is defined as so-and-so. Or third thing is, what is your diagnosis of this? My diagnosis is, you have to write, start like this. You just cannot waver. Whatever you talk, your talking should be a very assertive and good volume and no hesitation. Even if you make a blunder, make the blunder without hesitation. Don't just keep on grumbling or mumbling. So that is not right. So that is the best way to tackle the viva. And another important point in the viva, Abhilash, if you don't know something, immediately say, sir, I don't know. Don't try to bluff because the examiners are clever enough. So tell, or suppose if he says, have you examined this? If you have not examined, no, sir, I missed it. So I admit your deficiencies very frankly. Examiners will appreciate that. So focus on the viva, focus on look into the examiner's eyes. Don't look at the floor, don't look at the terrace like that. Look into the examiners because eye contact is very important. And again, be very courteous with the patients. When you are examining the patient in front of the examiner, a lot of examiners, including me, will see how courteous you are with the patients. Okay, that's a very important point here. You should keep it in mind. Sir, if someone is planning for hospital in Tier 2 or Tier 3 cities, his fellowship is compulsory or 2 to 3 years service after residency. Fellowship is not needed for Tier 2 or Tier 3. Your experience is good enough in as a senior resident, but you should be able to know which things need a specialty practice because you can't do everything. Suppose, let us say, gross scoliosis has come. You should have some spine surgeon who will come and help you out. So like that. You don't take it on your own, everything. Okay. So like that, if you got a very big pediatric orthopedic case, like a congenital developmental dysplasia, where you have to recreate the acetabulum, don't do without expertise. Call a pediatric orthopedic surgeon, let him do the surgery, and then you can share with the patient that I have done with so-and-so, or you can simply tell I have done it myself. But let the expert come. Okay. So that's what important. Okay. Yeah. So now the important thing is when you start the practice, I told you already, step one is treating the patient as a family member. So very, very important. What all little success I have got in my life is because of that attitude. You can see that my badge here, guest first. So I won't even call patient in our hospital. We call them guests. So you have to treat them like that. When you get that heart into the practice, I used to have a principal who used to say, whether you are a doctor of allopathy, naturopathy, or homeopathy, first of all, you should have sympathy. So that's what important. That sympathy and compassion, if you have that, you will be a winner. So develop that. All these things are secondary. MS Ortho, DNB Ortho, subspecialty, fellowship, all these things are secondary to that compassion. So number one, develop the compassion. Number two, develop a good team. Again, team is important because orthopedics is a team game, not a single game. Very, very important. So develop a team in the sense you develop a good receptionist and a good secretary and good physiotherapist and good theater nurse and a good patient counselor. All these members. Your physiotherapist can become a counselor, no problem. But these people should spend more time with the patient and impress him that you are in a safe place. So don't wait until you get a practice to build the team. Develop the team on the day one. Even if it is sharing whatever little money you got, but that is important, very, very important. So that is point number two, develop the team. Point number three, put money in getting good theaters. You wait for some time to buy a big Mercedes car or a BMW car, but don't, under build the theaters. So put all your money in the first 5 years into your practice, especially in theaters and in the patient comfort areas. Afterwards, you can take the money and buy a new car, no problem. And there is point number three. Point number four, always be ethical and professional. There is not a single time where you should do a surgery unnecessarily. A very important point. So, as I said, if you don't know how to do the surgery, let them come back again or call your expert. But don't go into theater without having a proper expertise. I have seen many thousands of complications happen because of this inadequacy of the expertise or a gap between the expertise and the requirements. So please be careful and be aware of that. Abhishek, could you please shed some light on the prospects of pursuing MCH in orthopedics and how it might impact one's career? MCH will add some value to your career and your visiting cards, Abhilash, but Abhishek, but nothing more than that. So you don't need to worry too much or spend great time and money to get the MCH degree. If MCH degree comes to you without much bother, take it. But you don't need to worry too much about that. Nowadays, as I said, in my days, a lot of value was there for foreign degrees like FRCS and all that. Nowadays, nobody bothers. They just see how good you are and how good communicator you are. I've seen many people with just basic degrees doing extremely well, and with people with 10 foreign degrees not doing anything in India. So the degrees are not direct passports to practice anymore. I'm telling you. So single proper Indian Medical Council registerable degree, postgraduate degree is good enough in orthopedics. Okay, fair enough. If you got FRCS, we got MCH, that adds a little bit of value, but it is not mandatory. So that's what it is. Okay, yeah. So now, as I said, first thing is build a group team. Second is work properly. Third point is don't get that this doctor is money-minded tag. Don't do that at all. Put all your efforts not to get that tag. How do not you see? You are not a Mother Teresa. You are not working in a charity hospital. You have to earn and you have to feed your wife and family. But having said that, you should never exhibit your greed to the patient. It should not be greedy at all. As I said, every good doctor, every successful doctor is a rich doctor. I've never seen a poor doctor who is a good doctor. It's a matter of time. So you got to be patient and you got to wait until you get a good amount of time to earn the money. So don't be too greedy in the first year and don't try to flee the patient. You will get a very bad name and you will never recover from that. So that is point number 3. Point number 4, I already told you, treat patient as a guest. Point number 5, if the patient gets complications are bound to happen. The only two doctors who don't get complications are number 1, who never operates, number 2, who bluffs. So that is not the right thing. So what I'm suggesting is when you are operating, you will get complications, but face the complications directly. As I said, the only way to treat a complication is through it, not around it. That is the most important point. Some people are afraid and they are scared to face the complications and they keep on running away from the patients. Don't do that. As I say, my best patients or my best friends are the people who lost the lives of their relatives in my hands. Understand? So I reacted with them in a much more empathetic way, and then that really created a wonderful comradeship between me and the patient. So important point is treat the complications with the heart and put some money away for complications. I will put it as a red box or red kitty bag. Let us say you put a box in one of the corners of your consulting room. Every time you get a surgeon's charge for a good, happy patient, let us say you operate an ankle, you got, let us say, 20,000 rupees as a surgeon's fee. Out of that, put 1,000 rupees in this box or 2,000 rupees in this box, 10%. And this money will be used to treat complications in the future. Then it won't pinch you and it will help you a lot. And again, complications, majority of the complications in India, in your hands to be treated free of cost because the patient expects you to do, though it is not your fault. So that's what to be careful about that. Okay. Yeah. The number 4th point is always keep upgrading your training and your expertise modules. Okay. So just don't be satisfied with your MS Ortho expertise and curriculum. You have to have a very increased training and academic knowledge every year. So for that, you select 1 or 2 conferences every year, and then you got to go to attend the conference and pick up the latest knowledge. And point number 6, don't jump on a new things without much thought process. Lot of marketing pressures are there. They say, oh, you buy this robot, you buy that robot, you buy this, you buy that. Resist them. As I said, you got to try the new things there, but wait for some time until the old people like us use and tell you this is good, this is bad. So that is again important point. Okay. So update your knowledge. Then again, last point but not least is work-life balance. Very important right from the day one. Don't spend 365 days in a year to work. There is a family, there are your parents. So you got to develop your own mechanisms to spend time. I would advise at least half a day or 1.5 day, forget the Sunday, in 6 days, Monday to Saturday, take half day off right from the day one. Whatever day you are comfortable, Saturday afternoon or Monday morning, don't see any patients. Let the patients know that you're not available. That space you can spend for your own time or with your wife or with your children. So that work-life balance is also important. And again, spending time with your parents. Again, important point, parents are getting older, they need you, so you got to spend time with them. And so that's also, don't forget too much about that. So these are some of the important career points which I wanted to share with you youngsters. I'm sure all of you are 100 times more cleverer than me when I was your age. But I'm just the gray hair, get some wisdom. And so that's what I want to share this wisdom. I'm very happy that DocTutorials is giving you a platform, and I'm very open for career suggestions, and it will be a privilege and pleasure to interact with you guys. All of you who are subscribers to DocTutorials can get in touch with me through my email, guravaredy@gmail.com, GURAVAREDDY, or you can get in touch through DocTutorials, and you can write your individual problems. I'll try to answer them in writing as much as I can. So that is an important point I wanted to highlight that. And anytime you wanted to visit my Sunshine Bone and Joint Institute, you come and visit. You stay here for a couple of days as an observer. You see how the things happen and do it well. Whatever is that, let me tell you, my friends, you have selected a beautiful post-graduation. MS Ortho or Orthopedics post-graduation, DNB Ortho, is one of the best anywhere in the world. You know that America, it is one of the top 2 branches. So you have done that here. So now all is left is to pass the exam nicely and to practice or plan your career in such a way that you will be wonderful. Every orthopedic surgeon is worth minimum, I keep on saying, 5 lakhs a month once it is into the practice. So don't worry about money at all. You will be in the top 2% of the total people in India. You understand that? So any orthopedic surgeon, wherever he practices, can earn minimum 5 lakhs. Mark my words. So what I'm trying to say is, don't worry about money. It's an automatic byproduct of your practice. Concentrate on proper practice methods, upgrade your knowledge, and work with a kind heart and compassion towards the patient. Then you will be the winner. Okay? Yeah. Anything else? Anybody else wants to ask any questions? I'm available for the next 5 minutes. Thank you so much. Wish you all the best. Wish you great careers.
Thank you so much, sir.
Yeah. So anybody wants to ask any question, they can come onto the video or they can put it in the chat box. You can open the videos now. You can put that grid one. Yeah. This Karthika. Rakesh?
Yes, sir.
Yeah. All okay?
All okay, sir.
You know, there is a in Zoom, you can put a multiple grids now. Multi-viewer.
Yes, sir. Yes, sir. We can
Go to
go.
that. Go to that.
Yeah.
So stop the speaker view and go to multiple view. I think there are around 50 candidates are there.
We did, sir.
Yeah. That's squares long వస్తాయి. ఇది కూడా డాక్టర్ స్క్రీన్ షేరింగ్ కూడా మానేసి.
అది కూడా తీసేయండి.
రాకేష్.
Sir.
డాక్టర్ స్క్రీన్ కూడా తీసేయి. స్క్రీన్ మీద డాక్టర్ స్లైడ్ ఉంది. అది తీసేయి. Screen sharing this and I can see the people.
Hi, Rakesh.
Yeah, Roshan. I can see Sharanya. Hi, Sharanya. How are you? You can answer. Roshan. Roshan Raj. Minhas. Kalyani. Karthik. Pritam Patil. You can unmute yourself. Karthik. Karthik.
Yeah.
Rakesh.
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 Yeah.
Yes, sir.
Unmute everyone and put me the grid. You are still screenshot.
I'm unmuting, sir. Everyone unmuting. I'm unmuting everyone.
అంటే మా డాక్టర్ స్క్రీన్ షాట్ తీసేసి మల్టిపుల్ వ్యూయర్ వ్యూ ఉంటుంది చూడాలి. అది ఓపెన్ చేస్తే నేను కూడా అందరిని చూడొచ్చు.
Yes, అందరి పడేలాగా చేయండి.
Sir, we did, sir. Actually, we are waiting for the doctors to accept the panelist access. Once they have accepted, then only you can see the grid view, sir.
Yeah, but ఇప్పుడు నా డాక్టర్స్ అని వస్తుంది ఇక్కడ అంతా.
ఇప్పుడు doctutorials లేకుండా ఏమైనా చేయొచ్చా?
It won't visible for the students, doctors, sir. It will visible for you and me only, sir.
అది కూడా తీసేయొచ్చా ఆ స్క్రీన్ doctutorials అనేది?
No, sir. No, sir.
Okay. But it's accessing it.
All doctors, I'm requesting you to accept the panelist access, and if you have any queries or doubts, you can ask the sir.
Yeah, I'll come again sometime in the future and we'll discuss one-to-one interactive sessions, clinical subjects and all those things also. Okay.